welcome back everyone. This is session 4 in our implementing a self-measured blood pressure or SMBP program in the clinic setting. So today's session is going to be on training patients to self-measure. So my name is Andrea Boucher. I will be your presenter for today. So thanks for coming back and rejoining us for our 4th session. So like we have started off all of our previous sessions, we'll just go through some introductions and have each of you give an update on those action planning questions that we had shared at the end of the last session. So if you remember what those were from last month, that was if you determined your process for completing device accuracy tests. So were you planning to do those in advance, at the point of care, a combination of both? So kind of what that looks like for you and your organization. So I will go ahead and I'll just go through the grid as I see everybody. So if you can just give your name, your title, and your organization, and then also your response for these round robin questions. So I will go ahead and start with Kelly. I see you in my top row.
So I'm at a conference in Houston. I'm at a crazy busy hotel. Is the background noise crazy? Because I could just type in chat.
Well, you sound perfectly clear.
It is. It's like party up in here. It's blasting music. So my name is Kelly DeLong. I'm the Associate Executive Director for Muskegon YMCA. So it's like right here, Michigan. And as far as determining our process for device accuracy, so we do it at point of contact. So we have both virtual and in-person office hours where we would do that with them if they're virtual, but obviously watch them go through that process if they're doing virtual office hours.
Perfect. Great. Thanks so much for sharing, Kelly. All right, Stacy, I have you next.
Great. So I'm Stacy Mavis. I'm a operations senior manager, and I'm also working with the quality innovation department for Inclusa. And so ours is probably a little bit different because we're not a clinic type facility organization. So what we talked about when Tina, Tricia, and I met yesterday was because we'll be purchasing a new device for each of our patients that we enroll with this, and then having the registered nurses that are out there just check or try to ensure device accuracy at least annually, or if there's concern with readings or something along those lines. And then we wouldn't be taking devices back, so we wouldn't necessarily need to ensure accuracy between loaning it out, just because we would give everybody their own individually.
Great, thanks for sharing, Stacy. That was going to be my question, if you were loaning these out or if they were going to be kept by the patient. So that's great. Tricia, it sounds like you and Stacy work together. So if you just want to introduce yourself and if you have anything else you'd like to add.
Yeah, nothing else to add other than my introduction. So Tricia Mayak, and work with Inclusa in quality for many years. My background's in nursing. And so looking forward to continuing with our learning and the application that we can do within our organization.
Wonderful. Thank you, Tricia. And Anne, I have you next.
My name is Annie Buchman. I'm a community health specialist with the Oneida County Health Department in Rhinelander, Wisconsin. And then determining our process. So currently with the health department, I'm just working with other facilities, helping set them up. So we have done in the past a pilot with the Pharmacy Society of Wisconsin, and we did blood pressure point checks with the pharmacies, and all of them were in person and they all got fitted and tested at the same time for accuracy. And now I'm going to be working with the libraries with the lending program and then through the American Heart Association. So it'll probably more than likely, most of them will be in person. We do have the option of telehealth, but that's kind of where we're at.
Okay, great. Thanks so much for sharing, Anne. All right, Shayna, I have you up next.
Sheena with the Olmsted Medical Center in Rochester. I am more of a listener than anything. We just started with a third party to do blood pressure monitoring. And I don't know a lot of the process for it, but I do the clinical build for the population health part of it. But I wasn't involved at any of the understanding of what they're going to do for the devices or anything like that. So more of a listening person.
Sure. Well, thank you for joining us, and thanks for sharing, Shana. All right, and lastly, I have Tina.
Hello, Tina Schrader. I'm with Inclusa in our quality innovation department, working with Stacy and Tricia. One thing to add to Stacy's information sharing is that Inclusa is the devices that we will be authorizing and purchasing for our members enrolled with our MCO we are choosing them from the US blood pressure validated device listing to ensure their validation of the devices. And we are picking about 3 or 4 different models for teams to choose from that may work best for our members, i.e. there are some validated blood pressure wrist cuffs on that listing for people that have an inability to get the cuff around their upper arm, etc. So really excited to get moving forward with this.
Wonderful. Thank you for sharing, Tina. All right. Well, thank you. Did I miss anybody? I don't think I did. I think we're good. All right. Well, thank you everyone for sharing those updates. It's nice to hear all of your different processes that you already have in place. So thank you so much for sharing. All right, so this slide just shows kind of where we're at with our collaborative schedule. We are currently in session 4, and we do have 2 more sessions with you all. So same days and times. So we hope you're able to join us for our final couple of sessions to wrap up this SMBP structured collaborative. So what we are going to go over today is techniques for accurate measurement. So how you can train patients on how they will be measuring at home on their own, and then go over some resources that will be available to patients for proper blood pressure measurement so that they can reference those. But we are going to make this session interactive. So I would encourage you, if you have a pen and paper or some way to just jot down some numbers as we're going through our session today. So as part of this presentation, we're going to be playing a little scavenger hunt game. So periodically, I will be asking you to just notice some things about yourself and the environment that you're in, and I will tell you how to score those things appropriately. So keep tabs of your points throughout the session, and then at the end, we'll go ahead and tally all of those up. And just like golf, the lower the score wins. So make sure you have something available to write these things down. So for our first scavenger hunt item, I'm going to ask you, are your feet on the ground and are your ankles uncrossed? So if you're like me, you might sit with your ankles, kind of tucked together. So if your feet are not both supported on the ground, or if your ankles are crossed, you can go ahead and give yourself 10 points for this item. All right, so this slide just shows a video on training patients for SMBP, so how they can properly measure at home. So this is a really great resource that you can share with your patients. It's about 3 minutes long, and I can go ahead and let me go ahead, stop sharing, and I will pull it up so we can go ahead and watch together. But it's a great training resource for patients. Like I said, it's about 3 minutes, so it's a good length video that kind of captures their attention. Let me go ahead and make sure I'm sharing my sound. So if you're interested in sharing this with patients, this will be available. It's linked on the slides.
Self-measured blood pressure monitoring is important and needs to be done correctly so it can be used to help improve your health. Let's review the basics. Self-measured blood pressure monitoring is when you measure your blood pressure while not at your doctor's office or another healthcare setting. Self-monitoring will help your care team gain a more complete picture of your blood pressure over time. This is most commonly done at home. The American Heart Association and American Medical Association recommend using an automated, validated device with an upper arm cuff, and preferably one with memory that stores at least 30 blood pressure readings. If you're unsure, ask your doctor or pharmacist for advice. Typically, you can measure your blood pressure with just a push of a button. Make sure the cuff you're using is the right size and fits properly. If you are not sure, ask your care team. Many factors affect blood pressure results, so it is critical you follow the instructions your care team provides on how to properly self-measure. Watch this video closely. If you have any questions, ask your care team for help before getting started. Let's review step by step how to properly self-measure your blood pressure. First, be prepared. You will be taking your blood pressure twice each morning and twice each evening. If you take blood pressure medication, measure your blood pressure before you take your medication. Prior to measuring your blood pressure, make sure you empty your bladder and avoid exercise, caffeine, and tobacco for at least 30 minutes before getting started. Find a quiet space without distractions. Second, get in the right position. Sit with your back supported and do not cross your legs or ankles. Have your feet flat on the floor. If your feet don't reach, place them on a stool or other object so they are supported. Rest the arm you will use to measure your blood pressure on a firm, flat surface at roughly the level of your heart, which is about mid-chest. Have the palm of the hand of that arm face up to relax all of the muscles in the arm. Place the blood pressure cuff on your bare upper arm so that the bottom of the cuff is just above the elbow. Once you are positioned properly, rest quietly for 5 minutes before taking the first measurement. Third, while measuring your blood pressure, do your best to make sure the room stays quiet and avoid talking with anyone, watching or listening to TV, and using the phone or other electronics. Perform your first measurement. When completed, write down your blood pressure numbers and your pulse that are displayed on your device. Wait 1 minute. Then repeat for your second blood pressure measurement. Write down your second blood pressure numbers and your pulse. Your care team may give you a form to use to write down all of your blood pressure measurements and pulse. Continue your self-measured blood pressure monitoring routine according to the instructions given to you by your care team. Report your blood pressure results to your doctor's office in a timely fashion, and be prepared to discuss results and take action if needed based on the information you provide. Self-measured blood pressure monitoring is a great way for your healthcare provider to get a more complete picture of your blood pressure. For confirming a diagnosis, assessing blood pressure control after changes in treatment, and monitoring blood pressure control over long periods of time. Remember, you play an important role in ensuring the results your physician or healthcare team receives are accurate. With accurate information, your care team can come up with the best treatment plan for you to improve control of your blood pressure.
Right. So I think that's a really great resource that could be shared with your patients. It kind of reminded me of like a flight safety video. So it gives you a lot of information in just kind of a short amount of time. So again, a great opportunity to share that with your patients. Oops, I don't want to start it again. Here we go. Okay. Going into our next scavenger hunt item, are your legs uncrossed? So if you're sitting with your legs crossed, maybe Indian style or one leg over the other, go ahead and give yourself 6.5 points for this item. All right, so in order to properly train patients to self-measure, we have 10 steps that we would recommend following. So I have these highlighted on the screen, but I'm going to go through each of them individually and share just a little bit more information. So I won't spend too much time on this slide. We'll just kind of go right through to item number 1. So the first step is to talk about what SMBP is and why it's important. So as you're having these conversations with patients about SMBP, explain what it is and really the importance of it and how it can help them get their blood pressure in control. At this point, it's also helpful to find out what the patient knows about SMBP, if they have any concerns about being able to do that at home or any questions that they might have. So at that point, you can provide some general information about SMBP and about hypertension as well. And also talk about the positive benefits of SMBP. So really how SMBP allows the patient's care team to get a more accurate and really complete picture of what their blood pressure is outside of the office setting. So it's looking at more measurements over a longer period of time and also in the patient's typical environment that they're used to. So it might give a more accurate picture. And then also sharing some educational resources at this point as well. All right, time for scavenger hunt item number 3. Is your back supported? So if you are sitting in a chair, but maybe it doesn't have a back, or maybe you're leaning forward in your chair, you can go ahead and give yourself 5 points for item number 3. All right, and within step number 1, talking about what SMBP is, there are a lot of great resources out there from Target BP, through the AMA and the American Heart Association. So giving patients printouts, resources that they can reference on what it is and how to properly position themselves, that can be done at this point as well. So these are just some examples of what we have for patient resources, and the direct access to those resources are linked on this slide. The second step is to teach patients how to use their device, and you can assist them with that. So making sure that the device, whether it's a loaner device or if it's the patient's device that they purchased on their own, making sure that it has the correct cuff size. If you have a cuff that is too large, that's going to underestimate the patient's blood pressure. And if it's too small of a cuff, it's going to give an overestimation of the patient's blood pressure. You also want to make sure that your staff is trained to measure patients' arms to make sure they're getting fitted in the right size cuff. So you can do that. I know it can be time consuming, but it can be helpful to do that with a tape measure, locating where the patient's mid upper arm circumference would be, and measure that using a tape measure. So we do have some resources linked at the end of these slides that can show you how to do that as well. But this slide just highlights those bladder cuff dimensions. So what a patient's arm circumference is, what size cuff they might fit into. All right, scavenger hunt item number 4. Are your
See, we have a question from Kelly. Sorry to interrupt.
Yes. Go for it.
You could have finished with the scavenger hunt thing. Can you clarify when it talked about, so even on the AMA video, it talked about, having a arm cuff, but, we just heard that there are some wrist cuffs approved from the AMA. Can you just talk about what that might be? So you said if it's too small, you'll overestimate. If it's too large, you'll underestimate. Why do they not recommend a wrist one if that is a good way to determine that you don't have to worry about cuff size, right?
Yeah, so typically, there are a few wrist devices that are approved on the validated device, the validatebp.org website. I would recommend, if there is not the possibility to fit a patient in an extra large cuff size, that's when we would recommend using a wrist cuff. So if at all possible to use the upper arm, that's really kind of like the gold standard. Really paying attention to, because not all upper arm devices come with an extra large cuff size, kind of paying attention to that as well, because they kind of say it's a one size fits all, but that's obviously not necessarily the case. So if a patient is not able to fit in an upper arm device, that's when they would fit into the wrist device. Does that answer your question? Sorry, I lost my video, so hopefully that answered your question.
Sorry, yeah, I gave the thumbs up. We're good. Thank you.
Okay, thank you, because I can't really see anybody right now. Perfect. All right, so scavenger hunt item number 4, are your arms supported at heart level? So if one or both of your arms are not supported, go ahead and give yourself 10 points for item number 4. All right, so continuing on in step number 2 on teaching patients how to use their device, we do suggest using that validated blood pressure device. I mentioned the validatebp.org. That is a website that you can go to make sure that the device is on that listing. Again, making sure that device has memory storage that's highly recommended, and also one that averages those readings if they're taken in that 1 minute apart time span. On here, we do say to not use wrist cuffs. Again, it is recommended if there is not the possibility to fit the patient in the upper arm device, that is acceptable, but one device that should never be used is a finger device. Those are not as accurate as upper arm. And then if the patient is purchasing their own device or getting it through their insurance, have them bring them into the office and have them checked for accuracy, like we mentioned in our last session. All right, time for item number 5. Are you dressed in layers? So I know here in Michigan, it's starting to warm up and we're having some beautiful spring weather today. So hopefully you don't have too many layers on, but if you are wearing layers that cannot be removed, so if you can't take your arm out, or at least one of them, go ahead and give yourself 27.5 points for item number 5. All right, continuing on with showing and explaining how to use the device. You want to make sure you're doing a demonstration as you're training patients how to measure at home. So how to position that cuff properly on their arm, making sure they're doing it on the bare skin, that they're able to remove their clothing. And then referring the patient to the manufacturer's user manual for any instructions on how the placement of the tubing should be. Usually there might be some arrow markers to delineate that, and you can train the patients using those arrow markers, but the manufacturer's guide should also be helpful as well. And then also training patients on how to turn on the device, begin their measurement. So what the device should look like as it starts, how to push the start button, and then also how to troubleshoot if they are having any issues, and how to reference that in their manufacturer's guide. And then it's also helpful to explain to patients what those readings mean. So as they're going to be going through these readings and their measurement does display on the screen, explaining what that systolic and diastolic blood pressures mean. And we have a little kind of visual graphic at the bottom that explains what the top number means and what the bottom number means. All right, number 3 is to educate patients on hypertensive emergencies. So at what point does a patient call 911? If the patient is seeing some abnormal readings that, maybe over the last week, they, have had certain readings and now today they're looking a little off. So what does a patient do in those scenarios? So I'll give you some examples of what they can do in a couple of slides, but really want to make sure we're pointing out, at what point do they call 911? At what point do they call the physician office? We really want to make sure we are kind of just not directing all patients to the emergency department. We do obviously try to reduce emergency department visits and readmissions. So it's important that if they are not experiencing certain symptoms, that they can call the physician office in that case. All right, item number 6 is, are you talking? So I hope I'm the only one talking at this point, but if you're having a side conversation, go ahead and give yourself 6 points for this item. All right, so helping the patient understand what a hypertensive urgency situation is versus hypertensive emergency. So as the patient is taking their readings at home, any scenario where they have a reading of 180 over 120 or higher, if they do not have any symptoms, they're not experiencing any symptoms, that is a scenario where they can call their primary care provider's office. A hypertensive emergency is when they are having those readings of 180 over 120 or higher, and they are experiencing symptoms. So that could be chest pain, shortness of breath, if they're having back pain, any experiences of numbness or weakness in their extremities, any change in vision, if they're having difficulty speaking. So if they're experiencing any of those kinds of symptoms with those elevated readings, that is when they would be instructed to call 911. All right, so the next step is number 4, to help the patient prepare to measure their blood pressure. So for this would be before the patient kind of sits down and gets ready to take their readings. tell the patient to use the restroom if they need to, have them sit quietly in an area where they have a chair with the full back support for at least 5 minutes before taking their blood pressure reading. Also, let them know to not talk or have a conversation with another person. Also, if the patient is, actively listening, so someone else is talking to them, that could also elevate a blood pressure. So make sure they're in a nice, quiet space, and not using any electronic devices. So that kind of distraction with a TV or a phone can also elevate blood pressure. So having them kind of turn off all of their gadgets before measuring. Also, if they take their blood pressure medication, have them take their blood pressure prior to taking that in the morning and the evening. Also, reminding the patient to wait at least 30 minutes after eating to take their blood pressure. And if they are a smoker, ask that they do not smoke at least within that 30-minute window before measuring their blood pressure. All right, scavenger hunt item number 7. So pardon the inquiry, but do you need to use the restroom? If you do have a full bladder, go ahead and give yourself 10 points for scavenger hunt item number 7. All right, this infographic is a great resource. We have it linked on this slide that you can just pass out to patients that will help them in their process of getting ready to measure their blood pressure. So teaching the patients proper positioning, making sure they're seated in a chair with their back fully supported, that their legs should be uncrossed, their feet are flat on the ground, or if they can't reach the ground, that maybe they have like a footstool available to them that can be used. And then also, as they are going to measure their blood pressure, that their arms should be supported. If they don't have a tabletop that's high enough or near the chair that they're sitting in, they could use pillows on the armrest if that's available to them. And making sure that the blood pressure cuff is on their bare upper arm and that their arm is placed at heart level with their palm facing up. So as you're guiding patients to that correct position, you can also let them know that there are certain factors that just impact blood pressure. Sometimes some of these are not obviously able to be changed by the patient, but some of them are. So if they are experiencing any kind of anxiousness or nervousness, any stress or kind of negative emotion, that can impact their blood pressure. Obviously, certain demographics with age, sex, race, and ethnicity cannot be changed, but that also does impact patients' blood pressure. Their lifestyle, so their diet, exercise, if they are using any substances such as smoking or alcohol, that can impact their blood pressure as well. If they have any recent caffeine intake, if they've taken an over-the-counter medication or decongestant, again, or nicotine use, those can impact their blood pressure as well. And then also I mentioned talking or even active listening can impact that. As far as the measurement side of things, if there is air in the blood pressure cuff before they're going to measure, that could elevate their reading. Making sure that they are wearing that proper cuff size. I mentioned a cuff that's too large is going to underestimate the patient's blood pressure, and if it's too small, it can overestimate it. And then making sure the cuff is wrapped evenly around the patient's arm, because if it's not, if it's kind of like wrapped unevenly, it could potentially come off when the cuff is inflating. So we have a couple of bonus questions for our scavenger hunt. So have you had caffeine in the last half hour? So if you have consumed that within the last 30 minutes, go ahead and give yourself 5 points for bonus item number 1. All right, moving into step number 6, teaching patients how often they should be measuring at home. So typically what's recommended is having the patient take 2 sets of measurements per day. So 1 set of 2 readings in the morning and 1 set of 2 readings in the evening. Again, this would be before they take any of their blood pressure medications. Again, each set is containing 2 measurements, and those measurements are going to be taken 1 minute apart. So most devices do have it set up where they take multiple readings, and the patient can kind of just sit there and rest, and it will kind of go through this cycle on its own. Some devices you have to just kind of do that manually. So that is what's recommended for the frequency. And then this should be done for at least 7 days. And the patient should have at least a total of 12 readings to give you a great picture of what their blood pressure is at home. This is also the case for how many readings are needed. We mentioned the CPT codes that you're able to use for billing. So this is also the number of readings that is recommended for that as well. And then next is to show the patient how to document their blood pressure readings. So we went over like what to do if the patient's blood pressure is too high, also letting them know if they think their blood pressure is too low, what they should do in those scenarios, and especially if they are having any symptoms, what they should do with that. And then work with patients on how you want them to communicate those readings back to your organization after they have that kind of full picture of a week's worth of measurements. This could be different for every patient. Maybe you're kind of meeting them where they're at. Maybe you have an option where patients could submit them back through a portal or some sort of electronic communication that they could communicate those readings back. Maybe it's as simple as the patient is writing those down. You have a paper log that you've given the patients to jot those down. Or maybe it's just a phone call where, you know, the patient goes over each of the readings that they've had over the last week. And that's a way to capture that too. All right, bonus item number 2, have you smoked in the last half hour? So if you have had a tobacco product within the last 30 minutes, you can go ahead and give yourself 5 points for bonus item number 2. And step number 8 is to prepare the patient for dealing with any errors or problems that they might be having with their device. So patients should really know how to troubleshoot their device, where the manufacturer's guide is that they can reference if they are having any issues. But as you're training these patients, if an error in a reading does occur on the device, you can show the patient how they could start over and retake their blood pressure. And then providing the patient with instructions. So if there's a specific number you want them to call as far as any readings that they might think are just kind of abnormal, giving them that process on what that looks like at this point in the process. And step number 9 is to check that the patient understands how to correctly measure their blood pressure. So this is where you could use the teach back method, where the patient could then demonstrate back to you all of the things that you went over and how they would be properly taking their blood pressure at home. So at this point, you would just give any feedback to the patient, any corrections that they might need in their process, and then give them some printed resources, reminders that they could use while they're doing it at home. And then the last step is to do that device accuracy check. So again, if the patient's device has not been checked for accuracy yet, this would be the point to do that, that they can be tested against those office measurements, especially if you are suspecting the device might be giving you some inaccurate readings. So we went over this in our last session. So just a reminder, if there is more than a 5 millimeter difference between the office measurements and the patient's device, that is when you would be able to use that device. So accuracy checks should be done after the purchase of a new device and then every year after that. So this slide is a good checklist if you want to use something like this as you're educating each of your patients. The source for this is linked on the slide, but it goes through kind of everything we went through today, each of those 10 steps on how you can train your patients. And it's just kind of like a nice visual that you can kind of check off that each of these has been done with all of your patients. All right, so bonus item number 3 and our last item, were you just doing some moderate or high level physical activity? So if you were in the last 30 minutes, go ahead and give yourself 5 points for this item. So now it is time to go ahead and add up your score. So we should have had 7 scavenger hunt items with those 3 bonus items. So go ahead and add up your total. And if you would like to, you can share your score in the chat if you would like that. So we can kind of see where everyone's at. But what do these numbers mean? So if you kind of caught on with what I was doing, I was seeing if you were in the proper position to have your blood pressure read. So those points that you were assigning for each of these questions were kind of equating to how much that could impact your systolic blood pressure if you were to have your blood pressure read in the position that you're in this session. So each of those items kind of equated to a different level. So that's kind of highlighted here on this slide. It was a little bit of a range for some of these. So we took the average points for those on what that might look like. So if you looked at your total score, which I see a couple of you added those in chat. So that's great, but it could have still impacted your blood pressure. I see ranging from 0 to about 11.5. So we could have had a little bit of a difference in what your systolic reading might be if we were, properly preparing ourselves to have our blood pressure taken right now. So thank you all for playing along and for sharing what your score was. All right, so with that, we'll go ahead and move into what our action planning will be over the next next month. So what you'll be kind of planning on and looking at before our next session. So what we'll have you do is outline how you're going to enroll patients in SMBP. So is this kind of creating a list and kind of designating patients who you think might be interested and eligible in SMBP? Is it at the point of care? Maybe they're coming into clinic and you see that, maybe they have some elevated readings in the office. Maybe they don't have hypertension. So you want to monitor that while they're at home. What does that look like for your organization? And who is going to be your designated patient trainers? Are there going to be certain team members that are going to be working with patients on the SMBP programming? Or is it just going to be anyone who is kind of doing that face-to-face patient care? So something to think about over the next month. And we will again do our follow-up to these action planning questions at the beginning of our next session. So with that, I'm going to open it up for any questions. Does anyone have any questions on any of the information that we shared today? And I lost my video, so if you are unmuting, I can't see you, but you can feel free to unmute and ask a question, or you can add it in the chat.
And I wanted to share, Andrea, I did post in chat the link to today's presentation slides. And then also we would love your feedback. So there is a link to a very brief evaluation as well.
Great, thank you, Carrie. All right, well, if you think of any questions, feel free to drop them in the chat. I've got just a couple more things to share for today. So if you have not yet joined Superior Health Connect, we would love to encourage you to do so. This is where we are housing all of our recordings and all of our information for SMBP. So that link on this slide goes directly to this group that we've created for you all, where you can access any resources. And if you have any questions, you can pose them in there, but go ahead and join Connect if you have not done so already. And just a reminder on our Back to Baseline and Beyond series that is still continuing on. We do have a couple of sessions coming up. One is next week on our year in review. And then we also have one coming up that I think would be relevant to this group as well for our May session is on the importance of hypertension control and stroke awareness. So if you're available, we would love to have you join us for those sessions as well. But with that, that is all the information that I have to share with you all today. I'll just pause it and see if there's any final questions or any final comments from you all today. And I'll stop sharing so I can see everybody. All right. Well, hearing none, I know everyone appreciates a little bit of extra time in their day. So we'll wrap up a little bit early and just want to thank you all for joining. And we hope to see you next month at our 5th session. Thanks, everybody.